Hello, my name is Myangela Hope, and I'm here to talk to you today about treatment evaluations for obsessive compulsive disorders. Imagine you're getting ready to go to church, you're feeling excited, but you also have repeated, persistent, unwanted thoughts, urges, or even images that are so intrusive that it keeps you from leaving your house. Every time you attempt to leave, you start to wonder, did I turn off the coffee pot? Did I lock the doors? You tell yourself, keep it together. I must go. When you leave the house, you repeatedly check the doors to ensure that they're locked. Finally, when you begin to leave, you feel so exhausted. This has been happening to you for a long time. Or imagine that every time you go out, you repeat the same behavior. Now you or the person in this scenario have obsessive compulsive disorders. Now, what I can tell you is that there are therapeutic approaches, principles, techniques, and biblically based techniques that are designed to treat people with obsessive compulsive disorders. Now, an obsessive compulsive disorder, also known as OCD, is a condition defined by the presence of repeated and intrusive thoughts, which leads to the need to conduct certain routines, like counting or hand washing, to alleviate anxiety. These fixations and repeated behaviors are recurring, persistent, invasive, unpleasant, repetitive rituals, compulsive behavior, mental acts, distress, impairments that disrupt everyday tasks and results in considerable anguish, according to the DSM-5. People with OCD have constant worries and have intense feelings, but there are treatment options available. The three types of therapeutic approaches that are most effective in treating OCD are cognitive behavior therapy, physiological pharmacotherapy, and behavior therapy. Now, cognitive behavior therapy is a proven psychological treatment that effectively addresses many issues. These issues are depression, anxiety disorders, substance abuse, relationship difficulties, eating disorders, and serious mental disease. The cognitive model of treatment focuses on the elements and operations of the mind and psychological growth. The therapeutic principle for the cognitive behavior model asserts that psychological issues stem to some extent from acquired habits of counterproductive behavior. Now, the good news is that with exposure therapy, OCD is treatable. Exposure therapy is considered the primary treatment for obsessive compulsive disorder. Several meta-analyses have indeed shown a significant decrease in symptoms of OCD after treatment. The exposure to anxiety-inducing stimulus and circumstances is carefully planned, regulated, with a preference for real-life practice. The second effective treatment option that I want to talk about is physiological and pharmacotherapy. Pharmacotherapy is drug-based medical therapy that involves the use of one or more pharmaceuticals to improve ongoing symptoms. Interesting enough, researchers suggest that pharmaceuticals are the first course of therapy in treating depressive disorder, anxiety, and obsessive compulsive disorder. Now, the therapeutic principle for the physiological pharmacotherapy model asserts that all psychological processes and events have a physiological foundation, which may be structural, genetic, biological, or chemical in nature. The therapeutic technique for pharmacotherapy treatment intervention includes prescription drugs like selective serotonin, sertraline, fluoxetine, fluoxamine, and paroxetine, which they're designed to reduce OCD symptoms. The last effective treatment I would like to talk about is behavior therapy. Behavior therapy is like a talk therapy that focuses on helping patients recognize and address negative habits. The idea is to adopt new behaviors to reduce or eradicate the problem behavior. Now, the behavior models are founded on the fundamental principles of the learning theory. These theories suggest that both normal and abnormal behaviors are learned over time through the learning processes, such as operant conditioning. The operant conditioning is a kind of learning where behavior is modified by the consequences, whether they be negative or positive, resulting in either a reduction or increase in that behavior. Now, the cognitive behavior therapy is an empirically supported treatment option and has an effective rate that exceeds 50%. Cognitive behavior therapy offers advantages or comparable results when compared to medication. As for behavior therapy that only focuses on operant learning, researchers suggest it is inadequate. The best response rate was seen in patients who received both cognitive behavior therapy and medication. A biblically based technique that has shown promising results is the Christian-centered mindfulness technique. The Christian-centered mindfulness technique is a time-honored method of reflection and prayer. Engaging in mindfulness exercises from a viewpoint focused on Christ may provide solace to people who experience challenges in dealing with obsessive compulsive disorder. Christian mindfulness provides a unique chance to enhance one's ability to perceive and comprehend the voice of God with great clarity. God instructs people to undergo a mental makeover through the process of renewing their mind, and that can be found in Romans chapter 12, verse 2. I hope you enjoyed my presentation. Thank you.